Midtarsal fault. What is a midtarsal fault? This is a fairly common condition of the foot. It is basically an arthritic spurring on the top of the foot due to a foot that is flattening out too much. This type of arthritic degeneration is generally, but not always, caused by excessive pronation or overflattening of the foot. As the arch collapses, it causes a jamming of the foot bones on the top of the foot, and eventually the bones will begin to form bone spurring as a result of the constant pressure of the two bones against each other. A patient will usually come into the office complaining of pain on top of the foot, where there is no history of trauma. Many times they will complain that the pain is worse when they are barefoot or in flimsy type shoes, and the foot will feel better when they are in sneakers. There are those that will state that in shoes they may also experience a tingling type pain in the area. What is happening is twofold. 1. As the patient walks and the two bones keep jamming into each other, pain ensues. Since there is now spurring and bone growth irregularity, the pain becomes an ongoing saga. Secondly, as luck would have it, there is a cutaneous nerve, superficial nerve, that runs right over the bony prominence. Every time the patient wears a shoe, the top of the shoe presses the nerve into the irregular bony prominences and the tingling or irritation from the nerve begins. Treatment of midtarsal fault. Conservative care. As mentioned earlier, sometimes just eliminating the shoes that seem to aggravate the condition, avoid going barefoot too frequently, and taking some anti-inflammatory medication for a short duration will solve the pain associated with a midtarsal fault, at least for the short term. Along with that, you may also want to try an arch support to support the arch and keep it from flattening out and avoid the bone-to-bone pressure. If your symptoms are more nerve-oriented than bone pain, wearing a donut pad with the center placed over the center point of nerve irritation will go a long way in reducing shoe pressure against the nerve and over time should improve your symptoms. Medical care. Prescription orthotics. If conservative care does not work, it is time for medical attention. It is imperative to alleviate the underlying cause, which is the overflattening of the foot. That part is usually addressed through the use of an orthotic which needs to be worn all the time. It is also worth noting that when wearing an orthotic you must wear shoes that accommodate both the orthotic and your foot. If the shoe is too shallow from top to bottom, then the raising of the arch through the use of the orthotic may actually creating more pressure from the shoe pressing on top of the foot. A deep-seated shoe is usually necessary. Prescription anti-inflammatory medication may or may not work better than what you are presently taking. Cortisone injections can be very helpful for a midtarsal fault, particularly if the superficial nerve is entrapped in the area and is inflamed. Physical therapy for a midtarsal fault may also help, but again, it is important to note that the underlying pronation has to be adequately addressed in order to have sustained relief. Surgical care. When conservative measures for a midtarsal fault fail, it is time to consider surgical intervention. There are a few different techniques available, but basically the goal of surgery is to remove the bone spurs and free the nerve from any fibrous tissue that may have surrounded it from all the inflammation. The surgery is a simple outpatient procedure. Read the full article at www.foot-explained.com/midtarsal_fault.html